I'm Dr. Cassie from Vetfolio and the host of Vet to Vet. Parasite control is such an important part of what pet owners can do to help keep their furry family members healthy. But getting pet owners to agree with the data and then actually following through are two totally different things. Joining me today is fellow veterinarian Dr. Joel Saylor. He's the Senior Professional Services Veterinarian for Merck Animal Health. And Dr. Saylor has a unique knack for connecting the science to real-life solutions, so I can't wait to hear his tips and tricks for getting parasite control into our patients. Dr. Saylor, thank you so much for joining me today.
Thanks, Cassie, for having me. I'm looking forward to our chat.
Me too. And let me tell you, one thing that just stood out to me immediately when I read your bio was that you got into veterinary medicine to solve problems. And that is so similar to my story. I mean, the problem-solving aspect of it is one of the major draws of vet med for me. So can you tell us a little bit about your journey?
Sure. Well, actually, it makes me feel great that I'm not alone, because I always feel like all of us get in this profession because we love animals, and I always felt like the outlier. So it's good to know.
Oh, no, you're in good company.
Yeah, no. So I like to solve puzzles. I still to this day do. And veterinary medicine at its core is solving problems for our clients, or even solving the owner's own, biases or beliefs to try and be able to do best for your patient. And we lose sight of that sometimes. And, there's a patient in there that, can't advocate for themselves. And it's our job to kind of get around the client and get their head wrapped around what we need them to do. And so it's kind of like mental chess, and I love it.
I agree. I mean, sometimes remembering that, we may know what the best thing is to do for our patient, but all of our patients come attached to a human. So we got to work with both.
Yes.
What's one of the biggest lessons that you've learned in this journey so far?
Never assume anything with a client. I worked in a very rural area, and I always coached my staff to make sure that they focused on providing the absolute best medicine that we have to offer, and don't make assumptions ahead of time, because, I found, regardless of the social economic status of a client, they all love their pets the same. There's no differentiation in how they love. And so we always have to put our best foot forward. And sometimes we lose sight of that when we're in front of clients, or, we make, opinions and that kind of thing, but always do your best. I think that's the one thing I've always tried to remember throughout my 30 years.
I think that's such good advice. I mean, we're taught that in vet school. I think we know it deep down, but it never hurts to get that reminder periodically.
Yeah.
How do we use that concept of really making sure that we're always making the best recommendations for our patients when we're talking about client compliance and giving medications?
Easiest rule of thumb I always use is recommend what you would use on your pet. Because at the end of the day, you and I are going to choose the best products, right? That are out there for our own pets, unless we don't like those pets. But I think we like our pets, right?
We keep them around and keep feeding them.
That's right. So, always recommend what you would recommend if it was your pet, or how about more importantly, your mom's pet, right? And so I think that's the key thing, is always try and practice, the best medicine for that pet. Let the client then decide if that's what they would like. And most of the time, they're going to accept that. I've never liked to give options, because options, then it always comes down to price. And at the end of the day, then the owner is naturally going to select the least expensive, because that's human nature. And thereby you're setting up a scenario for the owner to pick less than ideal medicine.
Sure. And if they pick less than ideal medication and then it doesn't work because it was less than ideal, I don't think. Yeah, exactly. Then it's going to come back to you and say, well, you didn't tell me to give the best thing. Now I wasted my money. And you're like, well, yeah. So I 100% agree with you.
Yeah. Well, and also you have to kind of know your client as well, because, there's certain things that we're going to ask clients to do that sometimes some clients just can't do that. You have a elderly client that has a 60-pound dog that you're now having them bathe it, 4 times a week. Is that reasonable? So you have to kind of, play to your audience, if you will. So.
Sure. And give them the out, make it okay to have that open dialogue with you, to say, yes, I can do that. No, I can't do that. sure, doc, you can send me home with that medication if you want to, but there's no way it's getting into my dog.
Right. Because again, at the end of the day, there's a huge difference between what we send home, which is what you and I call compliance, and adherence. And adherence is actually what gets done. And you can have compliance all you want, with shampoos or flea products going home. And then, are those products actually making it in their pet?
And I love that you brought that up, because that's a lot of what we're here to talk about today. So let's dive into how these concepts apply when we're talking about flea, tick, and heartworm prevention.
Flea and ticks, when we see flea and tick and heartworm medicines, we have to look at the difference between compliance and adherence. And of course, compliance is the product we send out the door. Adherence is the product that actually gets in the pet. And we know from data that we've looked at in over 500,000 transactions that there's a significant gap between the flea and tick dose that is given and then when it's repeated. And interestingly, when you look at that success data, flea and tick products perform differently than heartworm standalone products. The heartworm standalone products basically have much better adherence than we see flea and tick. And that's probably because clients think of that more as a medicine versus, this is a flea and tick product. Interestingly, when you combine a heartworm molecule, prevention molecule with a flea and tick, then that standalone product then begins to actually be perceived just like a regular flea and tick product. And so again, there is some intrinsic value when you're picking heartworm and flea and tick that you keep them separate, especially if the goal is to get as many doses in the scariest bugs on board. The heartworm will have the better compliance, and then then deal with the flea and tick separately. But on average, there's about an 8 to 12 week gap, and that's that time frame from when that product that you gave ran out of efficacy and when the next dose is given. And so you look at that, you're looking at basically a month and a half to upwards, 5 months between doses. And so, we can high five all we want because we sent a 6-pack out the door, but we're not getting anywhere if we only got 1 to 2 doses of that 6-pack in.
Man, that's scary to think about, like once every, 5 or 6 months, getting heartworm prevention into a majority of our patients. I know you mentioned having a rural practice. I'll play my hand a little bit here and knowing that practice was in Florida, which is where I am as well. And man, we have mosquitoes the size of birds.
Yeah, this is a state bird here, isn't it?
Exactly.
Yeah. And we export heartworms to the rest of the 48 continental United States. So.
We sure do, unfortunately.
Yeah.
So knowing how important this is and that maybe it is better to give these as 2 separate medications, are there reminder services that can help get these doses into our patients?
Oh, there's all kinds of, every practice management software has reminders. We've got third-party groups out there. Bravecto itself has a little QR code on their pamphlets that you can actually just scan right in the room, and that'll actually set it up. So for instance, if a technician gave the dose in the room, they can say, hey, Mrs. Smith, scan this code, and it'll remind you in 12 weeks to give your next dose. But there's plenty of reminders out there, but we're just not using them. And we need to have a tech champion in every practice to be able to make sure those things happen to improve our adherence.
So knowing how important it is to get these doses into our patients from a medical standpoint and the barriers that we run into with reminders, even with all of the electronic reminders that we have out there, are there other strategies that we can keep in mind to help increase adherence?
Well, absolutely. We know that when they go on auto reminder and the online pharmacies go to auto ship, that product is going out every month and that's arriving. And intuitively, if a product arrives, then we would hope that the client is giving it that day or a couple of days later. The problem that we run into with that situation is we're now moving products, unless you're using a veterinary centric type pharmacy, we're moving that pharmacy over to areas that actually want to have more involvement with our clients through telemedicine means and things like that. And these are individuals that don't have the vested interest and they don't have the connection or the relationship or really a true valued doctor-client-patient relationship there. And so it's important for us to find ways to either auto ship ourselves or use a pharmacy that is going to be helping us grow our pharmacy internally and be able to allow for auto ship and those kind of things.
Sure. And, when it comes to those online pharmacies, they can be really helpful. Just with what you mentioned about some of the other online pharmacies doing some auto shipping, I'll just share a story real quick. I'm thinking about a friend of mine who is also a client, and I was working with him and his dog, and he said, well, I went to your inventory and then I went to this other online pharmacy, and they were much cheaper at the online pharmacy. And I was just very honest. And I said, I get it. You have to do, whatever works for you and whatever's right for you. There is no way, like I'm doing the best I can. I can't do any better than that, just due to pure economics. And just letting that person know that it had nothing to do with a price markup for me. It just had to do, like I said, with economics. I ended up actually keeping the sale with me. He said, oh, okay, I get that. That makes sense. I'll go ahead and make sure I'm keeping the sale with you and supporting your business.
Well, yeah. And again, the way you handle that, just being upfront, I can't compete with this pharmacy. And that's one of those things too, when you're selecting products for your pharmacy, first and foremost, you want to pick a product that's going to work, right? Because, it's all about the pet to begin with.
But then secondly, you want to pick products that are going to increase compliance and adherence, and extended duration products like Brevecto, Fluorolon, or Chew only require a purchase once every 12 weeks. And then add to the fact, if a product like Brevecto, Fluorolon, or Chew is shopped online, Merck Animal Health has taken a very hard line at competition on online pharmacies. And so Dr. Cassi can absolutely compete because we strictly enforce our minimum advertised price. And that's also on auto ship, first-time orders. So there are no post-cart discounts available with any of our products.
I love that. I think that makes a huge difference in this electronic age that we're in.
Yeah, and again, so and the easy way to say is, your friend Bob or whoever it might be, Bob, I can get you this product today. I have exactly the same price. As a matter of fact, I've got a rebate, which will make it less than what you're paying for, online with this online pharmacy. Is there another reason why you would want to use that online pharmacy?
Sure. Hard to come back from that one with anything other than, well, not really. Mm-hmm. In this conversation, I hear you saying something that I feel like I've always found to be true. And that's that good medicine equals good business. And if we focus on the medicine, a lot of times that pays off in a business sense in the end.
I have always found that if I am providing the best possible medicine that I can and ignoring my personal biases about whether they can afford it or not afford it, most of the time clients are going to accept that. And the business takes care of itself. If you kind of, focus your practice on that philosophy, the numbers always show up.
Absolutely. Well, Dr. Saylor, this has been a great talk. It's been a pleasure. Thank you so much for joining me. Any final thoughts you want to share with us?
No, I just thanks for having me and enjoyed the conversation.
And thank you to Merck Animal Health for sponsoring this edition of Vet to Vet. Check out the Spark section of vetfolio.com for more of our B2B discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.